Hi, my name is Tajala Dar and I'm a pharmacy student.
Hi, my name is Song Ha. I'm an optometry student.
And today we will present a case regarding a patient who came to clinic for a routine checkup, and in this presentation we will highlight contributions made by each discipline to come up with a unified plan for our patient. So our patient today is AL, a 56-year-old man who presented to clinic complaining of chief complaint, I gained weight and I don't like it. So his main complaint is weight gain, and he explained that he started his other medication, glipizide, a couple of months ago, and at first he was doing fine. He also mentioned that he was taking it with metformin, and once he started his glipizide therapy, he noticed sudden gain weight, and he said approximately about 5 pounds. And AL said told his doctor, and his doctor added on another medication called Genumed, and AL thought it would help him lose weight. However, this was not the case. AL continued to take his glipizide and Genumed together, but felt no different. And AL also stated that he might have gained a little more weight since he started glipizide and Genumed. And past medical history significant of type 2 diabetes, hypertension, and hyperlipidemia.
For past surgical history, the patient has laser surgery for cataract 2 years ago. He also had a laser surgery for a drop of blood in the eye, which could possibly be a small hemorrhage from proliferative diabetic retinopathy. For family history, mother had diabetes, died of hypoglycemia at 83, father died of cancer at 70. And for social history, his occupation is limousine driver. There's no non-drug allergies.
So AL is taking quite a few medications, and one of the medications is taking glipizide 10 milligrams PO BID, Genumed 50 or 1,000 milligrams PO BID, simvastatin 20 milligrams PO QD, aspirin 81 milligrams PO QD, amlodipine 10 milligrams PO QD, and benazirol 20 milligrams PO QD.
And from optometrist's point of view, the possible ocular side effects for these medications, for glipizide, there could be a pain in the eye. For simvastatin, there could be pain or tenderness around the eye and cheekbone. And for aspirin, the patient could be at risk for macular degeneration.
His review systems are unremarkable, and his physical exam, we noted his blood pressure was 125/80, his height is 5'4", he weighs 170 pounds after his weight gain. All other physical examinations were unremarkable within normal limits. The laboratory data received from the patient was only his A1C, which was 7.5, and this was from an office visit 5 months ago. He hasn't got another blood test yet, so we can't really tell if his blood glucose is getting better or getting worse. And from just one data, it seems like his blood glucose is a little high, but it's a little okay at the point. Still not a goal though, less than 7% according to ADA. His diagnostic tests were not available, and the problem list that I came up with as a pharmacy student was more drug related, and the first one that we came up with was unnecessary drug therapy, and that was for his glipizide because it caused weight gain, and his doctor added Genumed. And from what the patient was telling us during the interview, it seemed like his doctor might have forgotten to discontinue the glipizide, but we can't conclude that at this point. Another medication problem we came up was clinically significant drug interaction, and this was between the amlodipine and simvastatin. And he's on the borderline dose of simvastatin that can cause this drug-drug interaction, which is 20 milligrams that he's taking daily. And if he was given more than 20 milligrams, then this would have been we would have had to discontinue the simvastatin and add on another statin or another blood pressure medication. But since he's at the mark of 20 milligrams and he hasn't experienced any side effects or adverse events at the moment, it is okay, and we could just recommend for his doctor to continue monitoring for this drug interaction. Another thing was needs additional follow-up because his A1C is not at goal according to ADA, and we recommend that he has a follow-up blood test with his doctor to see how his A1C is doing. And the fourth problem is that he has type 2 diabetes.
As an optometry student, I have 3 problems for the patient. The first one is the risk of proliferative diabetic retinopathy, and the second one is the risk for central vision loss, and the third one is the risk for macular degeneration.
So now we're going to talk about the problem, his type 2 diabetes, and we're going to soak up his type 2 diabetes. And to start off with, his subjective information that we received from the patient was his weight gain, his lack of exercise, and his wife stated that he has an unhealthy diet, and he also mentioned that he was on metformin at first, and then glipizide was added due to uncontrolled glucose levels, and now he's taking Genumet. The objective information that we received was his blood pressure is 125/80. So far it is controlled. His weight is 170 pounds, and this is after he gained his 5 pounds. His A1C is 7.5.
And as an optometry student, I would like to see the fundus photo and look for signs for proliferative diabetic retinopathy and macular degeneration.
The assessment we came up with was AL is a 56-year-old man with type 2 diabetes, hypertension, and hyperlipidemia. Due to uncontrolled blood glucose levels with metformin monotherapy, AL was started on glipizide 10 milligrams PO/BID. The patient didn't remember his metformin monotherapy dose, so it was not included. AL's blood glucose was better controlled with his therapy, although still not at goal. After some time, AL started to notice sudden weight gain. So AL's doctor switched his therapy to Genumet 50 or 1,000 milligrams PO/BID with glipizide still on board. AL reported he might have gained more weight with no change in his A1C levels. So it seemed like his glucose levels were being maintained, but he was gaining weight. And AL and his wife reported that AL had very much inactivity, and he had an unhealthy diet even before starting the glipizide. And due to the weight gain experienced by AL, it is reasonable to discontinue his glipizide and continue his Genumet therapy at his current dose. AL should be counseled on the importance of diet and exercise, and we recommend that his weight should be reevaluated at his next doctor visit, and then his A1C should be checked again in the next 3 months.
So now we are going to talk about the plan for the patient. Some goals of therapy we set up for this patient are to prevent further weight gain and promote weight loss, to manage blood sugar level and bring down A1C level to goal, which is less than 7%, and to increase exercise and improve diet. And as an optometrist, my specific goals of therapy for the patient would be to prevent possible permanent vision loss and to control blood glucose level to prevent progression of proliferative diabetic retinopathy.
So the pharmacological plan that we came up with was to discontinue his glipizide 10 milligrams PO/BID and continue his current therapy of Genumet 50 or 1,000 milligrams PO/BID.
And for the non-pharm recommendations for the patient, I will give the patient a home ancillary grip for monitoring central vision.
And non-pharm from a pharmacist perspective, or just overall, would be to promote moderate weight loss for this patient and recommend a dietitian to start, refer him to a dietitian to start medical nutrition therapy, which would basically help manage his diabetes and prevent other further complications. This is basically recommending less simple carbohydrates and more complex carbs like whole grains, vegetables, fruits, legumes, and to minimize or completely take out all trans fat and have an intake of saturated fats of less than 7%, to decrease his sodium intake to less than 2,300 milligrams a day. And it has also been shown that the Mediterranean diet, the low carb, low fat diet, is also helpful in patients with type 2 diabetes. And another thing to help promote weight loss we want to recommend is physical activity. Since the patient mentioned he had no physical activity at all, we would recommend at least 150 minutes a week of moderate physical activity, or 75 minutes a week of more vigorous aerobic activity. And or he could do at least 2 days a week or 3 days of resistance exercise. And we can also recommend for him is a diabetes self-management education, which will just help him for better self-management of his diabetes.
Currently, the patient has no visual problem, but he is at risk for proliferative diabetic retinopathy, and he should pay attention to any visual disturbance or any visual loss and return to clinic whenever needed. Also, he should get a routine dilated fundus exam every 6 months.
And some monitoring parameters that I would recommend based on his pharmacological plan for Genumet is to do regular self-glucose monitoring at home with his glucose meter if he has, and to get a A1C test regularly every 3 to 6 months. And some severe side effects to look out for, toxicity or adverse effects to look out for, would be pancreatitis, upper respiratory tract infections, headache, nausea, or vomiting. And we also like to recommend the patient to do a follow-up visit with his doctor to check his weight and to get a blood test next month. So for some patient education to provide our patient today would be to take the Genumet with meals to decrease upset stomach. And if he misses a dose, take it as soon as he remembers. But if it is time for his next dose, then he should only take that dose and do not double on doses. And if he experiences any cough, diarrhea, headache, upset stomach, runny or stuffy nose, he should contact his doctor if these side effects become really bothersome or persist or do not go away. And contact his doctor immediately if he gets nausea, vomiting, fever, itching, swelling, trouble breathing, or lightheadedness. He should not skip meals as he is supposed to take his medication with meals. He should swallow the tablet as whole and should not crush, chew, or break it in half. He should diet and exercise along with this current therapy, and he should check his blood sugar regularly at home and with his doctor for his A1C levels. And he should keep the medication away from children and store it at room temperature. So as a summary for a patient case, we would just like to highlight the important parts for our patient, which is basically to request his prescriber to discontinue his glipizide and keep him on Genumet therapy, and see how that will help him with his glucose levels after he takes the blood exam next month, I believe he was going to. And we also like to recommend the patient to be consistent on his therapy, and recommend exercise and eating a healthy diet, which will help him lose weight and hopefully help his blood glucose levels come down. And not only will he lose weight, it will help him feel better generally about himself and his health.
And the patient should really watch out for any changes in vision. If there's any problems or symptoms, please get a eye exam as soon as possible.
And that is all for today. Thank you so much.
Thank you.